Hello and welcome to Health Matters. I'll be your host. My name is Dr. Michael Chillemi, and today what we're going to talk about is rheumatoid arthritis. This is number 2 in the series on arthritis. So we are going to talk about the 7 critical signs of arthritis that you cannot afford to ignore. Rheumatoid arthritis can be a stealthy opponent with symptoms that aren't always clear-cut. Rheumatoid arthritis is a chronic inflammatory disorder that impacts more than just joints. In some rheumatoid arthritis cases, they can cause damage to various body parts, including the skin, eyes, lungs, heart, and blood vessels. As an autoimmune disorder, which rheumatoid arthritis is, the things that happens with rheumatoid arthritis is that the body mistakes its cells, its good cells, for bad cells. So the immune system actually attacks the body's own good cells. Unlike osteoarthritis, which is characterized by wear and tear, rheumatoid arthritis affects the lining of the joints, leading to painful swellings. This inflammation can ultimately cause bone erosions, joint deformities, and the inflammation associated with rheumatoid arthritis can extend beyond the joints and harm other parts of the body. While new medications have significantly improved treatment options, severe rheumatoid arthritis can still lead to physical disabilities. Imagine this. Another morning dawns, but instead of springing out of the bed, you lie motionless, ensnared by the very sheets that meant to comfort you. Every muscle protests against you. Every joint aches, as if you've been through a marathon in your sleep. Your fingers are stiff, unyielding like rusted gears. Your feet pulsate with raw, relentless tenderness. The thought of starting the day feels as a distant dream. And the promise of a long day is diminished. Steamy showers can coat the grudging warmth and the flexibility back into your body and into your limbs. So the warmness can make you feel better, but the day ahead is a battlefield that you must first conquer your own body before you face the world. What is really going on here? If you're relatively young yet experiencing swollen joints, stiff and tender joints, it is a clear sign that something is not right. On the other hand, older adults with achy joints might quickly jump to the conclusion, often attributed to old age and osteoarthritis. What many don't realize is that arthritis comes in many different forms. So rheumatoid arthritis is the condition where the body immune system attacks the lining of the joints. When your symptoms persist for more than 6 weeks, it is crucial for you to pay attention to your body and consult a rheumatologist for proper evaluations. Around 2 million Americans are affected by rheumatoid arthritis, with a significant majority being women. Although it is typically strikes in the Middle Ages, rheumatoid arthritis does not discriminate. It also can affect teens and young adults. So, what is exactly rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disorder due to a mix of genetic or hormonal factors. The immune system misfires. Instead of targeting invading cells, the body's white blood cells attacks healthy tissue around the joints. This misdirected attack leads to inflammation, pain, and a range of troubling symptoms. Rheumatoid arthritis can come and go, which makes understanding your body's signal more challenging, especially at the onset. It may start within a few weeks of wrist pain or sore shoulders, then fade as if nothing happened. You might even mistake it for the flu. But just think, As you're recovering from one, another wave of pain and fatigue can strike. Rheumatoid arthritis symptoms can emerge suddenly and intensely. Awareness is key. Listen to your body. These symptoms should not be ignored. Reach out to a professional if you suspect rheumatoid arthritis is in your life. So how do we diagnose rheumatoid arthritis? Rheumatoid arthritis is typically diagnosed through a combination of a few different things: patient history, physical exam, lab test, imaging. Initially, doctors consider clinical symptoms such as persistent joint pain, swelling, stiffness, particularly in the small joints of the hands and feet. Blood tests are also pivotal in detecting rheumatoid arthritis. Common tests that we also see for imaging are x-rays, ultrasounds, and MRIs can assess different joints and detect damage and monitor disease progression. X-rays can reveal joint erosion and narrowing of the joint spaces, which are always indicative of rheumatoid arthritis. Typically, X-rays play a crucial role in monitoring the progress or the progression of rheumatoid arthritis, especially in the early stages. X-ray may not reveal the soft tissue swelling, but it can detect the subtle erosions and the joint space narrowings around the disease. As the disease progresses, the X-rays become more pronounced. The joint space become more narrow. The bone erosion becomes more. And in advanced stages, severe joint space loss, extensive erosion, and joint deformities become evident. So what are the 7 signs for rheumatoid arthritis that you cannot ignore? The first sign is joint pain. Joint pain is often an early defining symptom, typically affecting joints on both sides of the body. So it's left and right, usually. And not everything affects left and right. So when you have rheumatoid arthritis, it's systemic. Systemic meaning it can affect throughout the body and bilateral. Different than if you were talking about like a pinched nerve, where it usually affects one side going down, or different other conditions. When it's an autoimmune type system, it's usually systemic and it can affect both sides. It usually begins in the small joints of the fingers, wrists, and ankles, but also can involve the shoulders, hips, and knees. Pain quality. The pain quality is typically described as aching, sharp, throbbing, tender, shooting, sometimes involving burning nerve pain. The second symptom you cannot avoid is stiffness. Usually the stiffness lasts for about 30 minutes, especially when you wake up. It's a classic sign. Some people may feel stiff all day, while others experience more intense in the morning and the evening. Joint stiffness can feel like an inability to straighten up or fully move the affected joints. The third sign you can't afford to miss with rheumatoid arthritis is swelling and warmth. Typically, patients feel swelling in their wrists, hands, or fingers. They feel swollen and heavy, and they could feel warm with it too. So comparing to feeling some other areas, the temperature can feel definitely hotter. And those are the big things that you really want to see. Make sure if you're feeling the swelling, you're feeling your hands getting tight, your rings maybe getting much tighter than they used to be for no reason. Now, sometimes when we eat something the night before, depending on the food we eat, obviously the salt content can raise our salt level, and that could do it too. But not that kind of swelling, right? So that's not what I'm talking about. I'm talking about different type of swelling. So you could eat the best, healthiest food, and the next day you're swollen in the morning, you're swollen in the afternoon, you're swollen at night, and your hands are hot. So the next thing, the fourth sign that you cannot afford to miss for rheumatoid arthritis is joint dysfunction. The impact on daily life of rheumatoid arthritis can significantly interfere with your daily activities, such as slicing meat, opening a milk carton, typing, climbing the stairs, doing basic functions is this thing, one of the things that rheumatoid arthritis can take away from you. Those little things that you don't even think about. Opening a can, right? Using your fingers to do anything. Your joints feel weak, tender, and swollen. Those are the signs you want to definitely pay attention to. Another big sign that you want to watch out for is fatigue. Overwhelming fatigue is common in rheumatoid arthritis. And that's common with a lot of autoimmune conditions. Typically, proper disease management usually alleviates the fatigue. General malaise is most often one of the signs of rheumatoid arthritis. It's the sense of feeling unwell, similar to the onset of the flu, tiredness, achiness. Those are the things you want to watch out for. The sixth sign you want to look out for is muscle loss. Rheumatoid arthritis can lead to significant muscle mass and strength loss. Early interventions can help manage and restore your function. It is critical that as we age, we continue to raise our muscle levels because we do lose it as we get older and older. And it is important that we stay strong, we stay functioning. And to do so, you have to actually lift a little bit of weight. You don't have to go crazy. Nobody's looking for you to be Superman, but light muscle strength type training is helpful. Obviously, everybody's different, and your ability to do that will be determined by your doctor or your physical therapist. But it is important for you to watch those signs and symptoms of muscle loss and pay attention early on. So those little signs and symptoms, you don't want them to get bigger and bigger. You need to actually start doing something about it, right? So that little small train gets bigger and bigger and bigger and bigger and bigger. But if we stop it in the beginning and we start doing something about it, then it never gets bigger and bigger. That's a fact. One of the other things that we want to watch out for, the seventh sign for rheumatoid arthritis is depression. Patients that have it, rheumatoid arthritis, can be depressed 2 to 4 times more than other patients. Rheumatoid arthritis compared to the general populations, the people just feel the tiredness and the sore, so they tend to be a little bit more depressed. It can be tied to the systemic inflammation, merely the reaction of chronic conditions. Some other symptoms that we can talk about that are a little less common, skin nodules, about 25% have that. Fleshy lumps underneath the skin, people can have that. Organ or nerve complications. And some patients have blood vessel problems, skin ulcers, nerve pain, numbness, weakness. Patients can also raise their risk of heart disease, lung complications, and metabolic syndromes. Actions to take if you experience any of these symptoms for more than 6 weeks. Make an appointment with a rheumatologist for an evaluation. Early diagnosis and treatment is crucial for managing rheumatoid arthritis and reducing its effect on you as your overall health. By being vigilant about these symptoms and vigilant about your health, timely medical advice can help manage your rheumatoid arthritis and maintain the quality of your life. Okay, now let's talk about some natural remedies for rheumatoid arthritis. So one of the herbal supplements that I'll suggest is turmeric. It's known for its anti-inflammatory properties. It also helps reduce joint inflammation, and it's very, very good for rheumatoid arthritis. Another herb I'm going to tell you about is ginger. Powerful anti-inflammatory herb that can be consumed in various forms, whether it's teas, supplements, or there's a lot of different forms out there. Dietary foods that have a lot of omega-3s, such as fish oils, flax seeds, walnuts, omega-3 fatty acids can help reduce inflammation and improve your joint health. Antioxidant-rich food incorporated into your diet, such as berries, leafy greens, and nuts, can help manage your oxidative stress and the inflammation that are associated with rheumatoid arthritis. Some key vitamins that you want to keep an eye on that you probably want to have in your diet is vitamin E. It's essential for maintaining healthy bones and immune function, ensuring adequate vitamin D levels can help manage some of the symptoms. Calcium, it's important for bone health to prevent bone loss. Often, rheumatoid arthritis has bone loss. So, what could you do treatment-wise with rheumatoid arthritis? So there's a lot of alternative type therapies. Obviously, chiropractic, that's kind of what we do. We help get the pressure off the joints, open up the joint spaces. We help alleviate the joints. Physical therapy, different physical therapy tasks help you function better, right? We help you use different tasks. Occupational therapy, especially for your hands. Exercise programs, acupuncture, massage therapy, especially massage therapy, they can help increase the circulation in certain areas and help reduce muscle tension. By incorporating these natural remedies, all those different vitamins and herbs I talked about, and some of the alternative therapies, that could be a natural way you can start treating and helping yourself. Not saying do not stop any medication, obviously, but you can add these to help manage your conditions. So what are the pharmacological strategies that are associated with rheumatoid arthritis? There are generally 3 classes of drugs that are commonly used in rheumatoid arthritis. Non-steroidal anti-inflammatories, typically NSAIDs, corticosteroids, and disease-modifying anti-rheumatic drugs. It's called DMARDs, DMARDs. So NSAIDs and corticosteroids have a short onset, which means they come on fast, while the DMARDs take several weeks or months to have any kind of clinical effects. So non-steroidal anti-inflammatories are a major effect to reduce acute inflammation, thereby decreasing pain and improving function. All of these drugs have mild to moderate analgesic properties, pain relieving properties, and independent of their anti-inflammatory effects. Aspirin is one of the oldest drugs of the non-steroidal class. There are many others. Could be ibuprofen, Advil, Motrin, Aleve, and many, many, many others. Now, corticosteroids, such as prednisone, have both an anti-inflammatory and immunoregulatory activities. Typically, corticosteroids are used early in the disease onset with some adjunctive therapy while they're trying to get you onto the DMARDs so your inflammation can come down. Chronic corticosteroids are used also in chronic cases with adjunctive therapies. Some of the side effects of prednisone includes weight gain, increased blood pressure, increased sugar, increased the risk of cataracts, avascular necrosis of the bone. So it is definitely nothing to play around with. They are strong drugs and they have a lot of effects on you. You and your doctor have to weigh the pros and cons of what works for you if that's one of your solutions. The longer treatment drugs, the DMARDs, typically improve symptoms of patients with rheumatoid arthritis. Not only have they shown the ability to improve symptoms, they actually can help they alter the disease and the cause. They actually have been shown to have improvement on radiographic outcomes. So, and it could slow down rheumatoid arthritis. So it is key and critical to have proper management. It is up to your physician to determine what works for you, but pay attention to those 7 signs. Pay attention to your body and to what you're feeling and how you're feeling. Your body's always telling you what it needs. We, as people, have to listen. Don't expect your doctors to know everything, because they don't. They just don't. You know your body, you know you, but you have to listen, right? So our bodies are always telling us things. And most times we as people don't really pay attention. We rather listen to what somebody tells us than understand what we have, what's going on with us, and how do we take care of something better. So what I always tell patients is do your own research. Look up everything you can for what you have. Be the best patient you can be, because it's your life. It's your responsibility, not your doctor's, your responsibility for your health. Doctors will try to help you. Again, it's the practice of medicine, right? It's not the end all 100% solution. So the practice of medicine that your doctors will do is practice. Everybody's a little bit different. What works for these 10 patients might not work for these 5 patients. Everybody's a little bit different. Everybody's ability to heal and change and underlying conditions and so many other factors are in there. But it is up to you to understand what's going on, what your symptoms are, and don't bury your head in the sand and say, oh, it's not me. This is not me. It can't happen to me. It can and it will happen. It can happen to anybody. But you have to take responsibility for you. Your doctors will help you, but be the best patient so you can ask your doctors the best questions. Unfortunately, in medicine today, a lot of doctors are very, very busy, and they're forced to see a lot of patients, and no excuses, but a lot of people don't give you the time you need or deserve to go through everything that you need in steps. And if you don't ask the right questions as the patient, you might not get the right test. You might not get the right diagnosis. You might lead to months and months and months of improper medications or no treatment, and then more and more pain and more suffering and more progression. Could be months, could be years. So the last little part I'll leave you with is it is your life. You need to be there healthy. Take advantage of everything that we have between the internet, research. Do your research, understand what you have, ask good questions to your doctors, write everything down. This way, when you don't get in there, you don't get the white coat syndrome where, oh my God, I forgot everything I was going to say. I can't believe I didn't ask this or that. Write everything down. Do it a couple days ahead of time so you don't forget. It is important. So I will leave you with this. Rheumatoid arthritis can be very, very debilitating if it's not properly managed. But it is also very, very treatable. Obviously, there's ranges in the middle and there's ranges on the outsides of mild and severe. But the more we do, the better we will function and feel. And that is what everything we need to do is about. We need to function. We need to feel. We need to do things. We need to be active. So go out and research, ask questions. It's your life. Be there healthy, because health matters. Have a great day.